May ganyan ka pa, wala na.
Oo.
Wala na? Eh?
Ito.
Buti ka pa, Besha, may isa kang viewer.
Naka 33 minutes na ako pero isa pa lang viewer ko. Idol ko talaga si Parb siya. Parb siya, you're my idol.
Pusa. 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 Wala si Syringe. Namuka na ako.
Alam ko na regalo ko dito, headphone.
Hindi mo ako. Ay, bibigyan ko, Besha. Buti pa sila siya may isang viewer. Ako no. Ay, meron na. Ayan na. Ayan na. Ayan na. Ayan na. We're sleepy.
Do you want to see how ito na is pang skin test ko dito. Do you want to see how MJ Maha Alice can skin test? I will skin test Ani.
No! Wala ka. Masakit yan.
So injection ba? Kung pinakamasakit skin.
Pero yun yung pinakagusto ko.
Maybe my
Dr.
friend
Greg.
Dr. Greg. I will skin test.
Guys, I don't have more lip balm.
Hi guys, please
Okay, she will going to make
guys,
a skin test herself.
ask a
Okay.
question and I will
We can make a
answer it.
challenge to you. We will eat all the entire wasabi if
Ikaw.
you guess this. If you guess. Hi, Sai Nagasai. Okay. We will make a challenge. This is wasabi. Wasabi is very spicy. You know that? It's very spicy, the wasabi. So our challenge would be
Para dalawa.
okay. Our challenge would be time out yan siya kay wasted naman yan. Okay, this wasabi is spicy food. If you guess how many male patient did Dr. Greg circumcise, then I will eat the wasabi. Okay? Guess how many male clients did Dr. Greg circumcise? Chat below. Chat.
Mahirap ang phone, guys.
No? No anyone? Nobody? Okay. Another simple challenge. If you guess it, asa na yun, Beshi? Kunwari, ano na to? Sila magugusto sa sarili ko. Okay. We make a challenge. This is a syringe. It has a very sharp needle. Okay, you see? Needle. That's very sharp. This needle is very sharp. See that? If you guess how much we delivered today, then I will skin test myself using this needle. Chat below. If no one, then we can sleep.
Mag-ano kayo, live kayo na nag-tutorial kayo.
Na.
Tutorial ka.
Pwede man din, kunwari lang ng tutorial. Okay, yeah, we have more views na. Okay. Okay, we have 2 challenge. Eating wasabi or hurting ourselves with this needle. Hello, Enzo. Hi. Hi, Enzo. Okay. You guys want to make a game? Okay, if you don't want, then we will be going to play charade again. Charade.
Nakita niyo na ba ang
Charade.
gawa ko na bago na kami
Nag-jojo.
break? Mas birthday niya kami nakita lang.
Matigin.
Okay, charades.
Pero pinakita mo na
Okay,
yung sa
guess this one. Do you guys want to play charades?
Kita mo na.
You wanna play charades, guys?
Saan?
Okay, guess what is this?
Ha? Ito?
Yeah.
Alright,
Ito,
hi
nakita
Randy
niyo
Lee. Yeah, we're still at work, Sir Randy Lee, and it is now 2:08 p.m. And how long are we now? Like almost 8-hour shift, and we have remaining like 5 hours to stay here. And no, not 24 hours, not 24 hours. We only have 12-hour shift today, but yesterday we have 24 hours. Did you daylight saving time? What do you mean daylight saving time? I don't get what you mean, Sir
Ibig
Randy.
sabihin sa morning.
Did you daylight saving time? What do you mean? I don't get what you mean. So I make a challenge, Sir Randy. I am asking everyone if they could guess how many delivered babies we did today, and if they guess, then we can
Ayaw, tingin ito po ba? Sama ko rin sa hospital.
Ano ko lang ito? Nakita. Ito ba yun sa itong nagkain tayo? Doon itong birthday? Ito ba yan? Yung nag-birthday ito man yun.
Hindi ko.
Ay, hindi pala ito. Parang nakita ko siya.
Parang kasama ko yan na pulis yan. Nag-race siya ngayon. Nag-race ko pulis.
Anak niya to. Ah.
Ano yung bubog siya eh? Char.
Uy, may asawa man yan.
Bakit pala?
Uy, Bobby. Ano tingin mo sa akin? Porque nalaman mo.
Hindi ah! Char ano?
Uy, lagi.
Kasi...
Pinagtanong kung binata yan.
Wag uy gosh, huwag ka mangguro ng ano iba. May mistaken yan. Okay, good morning, VP. Hi. Okay, wait, I make a challenge now. Like, I'm gonna kill myself here. Right now. Ganun, besyo, baka makita ng mga pasyente. Ganun mo good besyo. Two babies? No, not two. Not two babies. Hello from Thailand, original Bangkok. Okay, you don't guess it, guys. I will now. Usually open ko lang kasi yan. I will be going to make a skin test to Alice. No. Kunwari lang daw. Kunyari na pagkatakapin natin sila. Kunwari lang daw. Okay. Because nobody is correct. We still can do the challenge. I can make a skin test myself here. Wait, where can we put? Here? Ako lari, matakapakatin natin sila. Alice wants to stop me from doing this, but I want. Takutin na daw ako. Take my... stop mo daw ko na rin. Okay, here. I guess I need a mirror.
Big needle. Sir Angeli, if I take my blood, you will donate another blood for me.
Fake MJ's blood. No, not MJ's blood. My blood.
So randomly, if I take my blood in my using my hand, maybe you make a donation your blood for me, okay? Because I take my own blood, so that's why you make a donation blood for me.
Can I try your hand?
Meron ba lang makikita mawala sila? Reklamo sila.
Ha? Ikaw ang tawagin mo. Ikaw ang tawagin.
Okay, go.
Okay. Stop me from doing it, guys. Wait, where we find, now we find the vein. We find the arteries and the veins. Okay, yeah, you can do. Okay, kunwari. Wait, no. Sige, kunwari. Oh my gosh. Okay, now. Look at that. Oh my God, it's beautiful injection. Oh no. Baby, sige mo. Sige na, kunwari. Ano siya?
Ito.
More. Not, yeah. No. Okay, yeah, make a challenge.
Paningon tong kaibigan ko. Tanong mo si Sir Hanley kapag take ko ng blood.
Ano, you still want to continue the challenge, or I will inject. She changed her mind. She cannot do. She's very afraid.
It's beautiful.
It's very small. Halloween is over. Don't need blood. Okay, she said it's very, very small, the needle. So, yeah, I guess I can do it myself. Master Basin, good or bad? How many hours do you have left? I have like 5 hours left. Hello, HCB3. Hi. This is how you get a blood yourself. You only have to check if it is already locked. How can you open? You rotate this one, rotate. Lingaw lang sila.
Partial, where are you partial?
Rotate this one like that to remove, and then test if you can move it like that. You see? It's moving, and then you bring it back together with this. That's how you hold it, like that. Push, then get it again, doing it again. Greg, makapalat kami gan. Then do it again, then put it back together and rotate and lock, right? Then prepare yourself. Doctor, I'm fine here because I have a Dr. Greg who will save me when something is wrong. Okay, so I will
Buti pa siya
Fine.
23. Wala, lumalis na sa kasi barbecue. Nagpunta na siya dyan.
and then prepare finding your anong kunin ko, vein or
Skin lang.
skin only. Then ouch! Nabesin na sakit na kanina yun. Nalagay na ganyan ko lang siya, oh. Naganyan ko lang siya, oh, masakit na.
Hindi,
Uy. Oh, now it's unsterile. There's an ant. No. It's now unsterile. Look, there's an ant. Where is the ant? Okay. So, you only have to do it. Again, ang nagawas na naman ng ant. Now it's very unsterile. Unsterile now. A newborn. Ay, bagong panganak. Si ma'am, ano yan? Oh, sino ba na yan? Batax.
Natin, Day.
Ha? Sige na, Greg. EBS mo na, Greg.
Ikaw, break.
Expert na ako masyado sa BS, Greg. Yung mag-aaral pa ako hanggang pa naman mag 40 hours tayo dito, mag BS tayo. Ba? Pero dapat pag mag-duty ang... Yeah, we do surrounding.
Estudyante pag may
Yeah.
pasyente.
Mag-BS talaga yan siya. Yan ang gawin natin pagdating dito, i-assist ang mga ang nurse. Tapos mag-BS sila sa students. Yeah, we do it, sir. Okay. And ay, Mishi. Wait lang. Okay.
Tapos ilalayan yung order nila para sa tulong. Kaya doon ay paayos.
Yan mo talaga. Kaya alam natin kung anong gagawin na dito. We know that. Okay. Next is... Ang init ng kamay mo, Beshi. Ow! Okay. Next is injecting ourselves. Ow! Buing man yan, eh. Like that. No, we can make a challenge. Or we will get a wasabi. Kunwari. We get a wasabi here.
Pupunta kayo sa pagbibutas na yun. Nagkuha, di ba? Nagkuha ko ng blood, di ba? Nagkuha ko ng blood champion ko ko. Ano sa blood ko? Parang
We make a challenge to Alice. We inject Alice. We inject Alice. Ito. We inject Alice. Nice armpit. You like the armpit? Now I challenge MJ Alice. I will inject. I will skin test MJ. Hindi kita tusukin mo siya. Takot na ako. Now, are you guys ready? You know how I inject Alice? I only can shoot it by like this. Like that.
basta guwapo ba? Gusto niyo yung 13. Pag mga... Gusto niyo yung 13. Kasi kasi yung 13. Dito.
Yes, sir.
Yes, sir.
Alright, another challenge. Okay. I know I can inject myself alone. I can do it. As long as I laughed. Okay, you see my tattoo is now gone. This is how you inject yourself. And then you get injecting yourself like that. Disinfect it first with your saliva. No, with alcohol. Alcohol. And then you get it with your own fingers. No way, no.
Okay man lang ganun ni Greg.
And then inject it like that. Then once you get inside, try to check if there's a blood. If there's a blood, that's how you hold it. If there's no mataas sa Alright. That's it. Beshi, kailangan kasi na ano lang yung nahiwag man yan. Mahimik man yan. Magtanaw ang manguluin na parang siya. Tira magana na si Parsha. Sorry guys. How can I take insulin on belly? Okay, how you do it? Only you open your clothes and then disinfect the area and then do a subcutaneous injection and then hold this part, checked, and then press. Then get the needle, cover it, and that's it. Maganda talaga na ano. Okay, continuation. Where is it? I can't see you guys. I lost you. All of you, I lost. Alright, so after that, is it very knowledgeable? Ay, Beshi, pwede ka parang anong Beshi? Magturo sa kanila na ganito. Dito, how to hold this, how to inject yourself from this. So it's easy, okay? So disinfect and then use this one. Then hold this thing right here. Check. You can only do that, check. And then press. Then get the alcohol swab, cover, then remove. That's it. It's just very easy. All you have to know is just to get to know how to hold this thing. Either you do that, you do this, or like that, or yeah, lots of many ways for you to do, technique for you to do, or like this and that, or like this and that. Hindi mo niya makita. Okay, oh. Hindi. So yes, it's are we able to do this for the acupuncture massage, right? This one, I don't know. Oh, I have a really poor pain tolerance. Oh, it hurts. I have a really pain tolerance. You see that? Oh, I just feel it in my skin, but now it hurts. Ooh. Hala, siguro, di ba may iba beshi na naaalik ka mag-inject? The pain is a little bit addicted. A sharp pains from that. Ooh, like it. That pains. Oh my gosh. Ooh. Ah. It's addicted. Alright. Do you have any other question, guys? Another example. How will... oo nga, mag-ano tayo ng suturing, beshi.
suturing, you know how to do suturing. For example, this is your skin. This is your skin. This is your muscle. Then you only have to, for the subcutaneous injection, you have to make sure that you only hit the subcutaneous muscles. So this is the skin, this is the muscle. Don't hit the fat part, only the sub. So it is 45-degree angle injection, but make sure that everything is already disinfected and clean. So you have to, oh no, inject it like that. You see, where did I hit? It is in the subcutaneous, right? Then you do that, only little, checking if there's some blood, and then injecting. Then slowly removed like that. Or if, how about the skin test? It is only 5 to 10 degree angle from the first layer of your skin. You only have to point it. Make sure it doesn't hit the subcutaneous muscles. See that? It's perfect. 5-degree angle. Show it. It's perfect. That's perfect. It's the it's the intradermal injection. Then after that, you don't have to check. Well, hello, then do it. The same procedure. Then slide and then slowly remove. Cover it with sterile. Those pads or pads. And cover. How are we going to suture the perennial lacerations, wounds, and oh, I can show how I suture to you guys, how I do a suturing techniques. I usually do the subcutaneous suture, and I mean like the continuous suture, and then the simple interrupted suture. But we don't have a suture here. We only have the injection. We only have the injection. And yes, what else? We don't have a props or anything else. Or if you also can this one is a lot more bigger than this. This is the 1cc syringe or 1 ml syringe used for the skin testing, and this is for the antibiotic dilutions or for the flushing. Then we'll see if we can use the 1cc sharp syringe needle into the 10cc syringe needle. Yeah, it's still the same. You still can use it, but the problem is it's very small and the body is so big. So every time you administer a medication, you have to be sure that the line is patent, because this is so small, the needle, and it will be going to get stuck, right? So it's the same. You could also practice this one. these techniques, and then another pushing it with using your pinky fingers, holding two of your thumb and your first finger, then release the air like that, then bring it back again using this other finger, and then releasing it, then doing it again. Easy, right? When you only inject yourself alone using an insulin syringe, because a lot of people do not know how to make a techniques of how they use the syringe when injecting themselves from it, because it's hard for them to control the body of the needle. Oh, what's up? What's up? All right, another lesson today also, so we won't feel much more even sleepy, is we will be going to do how we can get the anthropometric of a newborn baby, because using the by using this tape measure. So the anthropometric is to get the measurement of baby's head, baby's chest, baby's abdomen, and baby's length. So what we're gonna do is just use the centimeter, not the inches. Then first, after the baby is born, we have to take the weight. Here in the Philippines, sometimes we use the pound, sometimes we use the kilogram. So after the wiping the baby, we usually bring the baby to the weighing scale and then weight the baby, check how many pounds in kilos the baby is, return it back to the mother's belly for the skin to skin contact, and then while doing the thorough drying, and we started to check the anthropometric of the baby starting from the head. Usually baby have that caput, or it is causes by the baby delivered so much long, so the head will be going to pretty much longer than usual, but it will return back to its shape after. And then they measure it. So let's see how big is my head. All right, so you get to know if the baby is hydrocephalus, if they have a big head, because there's a normal range for the size of the head of the baby. So using the centimeter, my head would be 58. Then checking my chest. Okay, chest should at least be in the nipple area. Checking nipple area. Okay, I'm sorry for this. Right? So yeah, using the centimeter, now I am 98 centimeter. Converted into inch, it is 34 inches. Then my abdomen, to make sure that I'm not bloated. Wait. What now? I am 79 79. How about the length? No, the length is I am 5 feet and 0 inch. Yes. So that's the anthropometric. Hello, Portia. MJ Alice is now sleeping, and I am making a lecture here because like some of the viewers is also asking about how to inject insulin, and I'm also sharing how to do anthropometric measurement for the baby. Okay, so I'm just showing them the techniques of how will you use and handle the syringe when you're injecting it yourself alone without anybody with you. All right, and next topic would also be um, about how we like it is a law in the Philippines. So in the Philippines there are so-called registered midwife and the registered nurse. So there's a procedure that the nurse can't do, but the midwife can do. So one of those procedures are removing the, I mean like, um, how can I say it in English? It's just like evacuations of the placenta. So the nurse shouldn't have to do the evacuation of the placenta, but the registered midwife will do. And the administrations of medication, the midwife shouldn't have to administer the medication, but the registered nurse can do. The midwife is also allowed to do the internal examination, but the midwife I mean like the midwife can do the external examination, I mean internal examination, but the registered nurse can't do. There's also like some of the procedures that the midwife can also do the episiotomy, but the nurse can do the episiotomy as long as the registered midwife has this long as the registered midwife has a certificate and training that she's allowed to do the episiotomy. And usually doctors should also do the episiotomy, but it's just rarely happens that the midwife will do because not all of those registered midwife has that seminar. And then the most challenging part about working at the hospital, like if you guys ask me which area would I like to be designate when I am in the hospital, I will choose to be in the special area, and that would be in the delivery room or at the operating room. But I would rather choose the delivery room because that's where I know my skills would be. So since I am a registered midwife, I know that I am able to do and offer the good services to the postpartum and to the patients who is in labor. That's where my superpower is, and I'd like to work in the delivery room. But the problem would be at the delivery room, it's just much more risky as your part. Well, everyone is also risky, like when you're in the OB ward or in the medical ward or the pedia ward, but you cannot really predict of how hard the day is would be at the delivery room, because there's some instances that sometimes it will be much more toxic than your previous shift the past few days, and sometimes there's no any other delivery, and you just basically calm, the area is just calm, and abruptly there's an emergency case and you've started to be much more busy. And what is nice about in the delivery room is because I like to give and I like to give a care for the pregnant, and that's why I choose this course. Being a health worker in the Philippines is really not the easy job. It's nag-speech ako dito. It's very Dr. Greg is now arrived after checking the patients. And then MJ Alice is now already sleeping.
Already die?
For a moment, die. Guys, can I take some rest? Like, I just need the bladder break. I just need to go in the bathroom and then I'll get back to you, okay?
Nag-plaster na. Nag-extra still na. Nag-bedside ako for today's video.
Okay, so we don't have more viewers. No one would like to listen, and there has to be no any other questions. All right. So our next, what is our next topic? Okay, so it is now about we talk about a clinical instructor. Greg, we now we talk about the clinical instructor. So what is a clinical instructor? Wala akong topic. Wala akong discuss sa kanila. They were my students. It seems like you guys were my students. Alright. So I just want to let you know guys about clinical instructor. So clinical instructor is a teacher. We consider that a teacher because they will be the one who will guide the students in a clinical settings or in a hospital setting practice. They will be much more responsible to whatever might be gonna be happen during the training of the students, whether it is all about the patient's care, it is all about the it's just all about like the student's care and how much your duty starting hours. Duty will start at around 7 a.m. And when I am working as a clinical instructor. But if you're working at the hospital, full-time job, and where my work, our full-time job is, I am working for at least 6 a.m. Exactly 6 a.m. Yes. So, yeah, clinical instructor considered to be a teacher, and I am one of those. MJ Alice is also one of the clinical instructor. Sir Greg, yun pa daw sarili ko gustahan. Wait, guys. Alright. Wait, guys. I'm checking myself here.
Siguro mga student na dito na malaki ng mga
Hmm? Ano? Ay, okay pala ang ano, ang connection. Hello, Amin. Siya. Hello, Amin siya. Hi. Alright, yeah, continue the topic. Okay, let me read you what clinical instructor is. Because now we're here in yeah, hello Amin. Thank you. I love you too. All right. So we're working here as a clinical instructor to get to know what we can do once our students is well going to go on duty here. So let me read you some definitions about a clinical instructor. So clinical instructor are responsible, as what I have said, for providing effective instruction and assessment during clinical practice and training of undergrad health sciences students in the classroom, laboratory, hospital, community facilities. So that is what our job is. So now, no, I am just only in my 12-hour shift with my friend MJ Alice and with Dr. Greg. Okay, yeah. So, how much is the clinical salary in the Philippines? So, I am just very much curious about how much the salary is of a clinical instructor. There are a clinical instructor work as a part-time. There's also a clinical instructor work as full-time. So, a clinical instructor salary in the Philippines, it says here, as per my research, it is around 36,058 pesos. Wow! How amazing! Really? Guys, clinical is, oo nga, oo, 38,000, 36,000. Clinical instructor salary in the US is 36,058 pesos.
Siguro kung may masters.
Okay. So we have here oh, there's may hiring sila ako clinical instructor healthcare and technology incorporation Pasig City. The salary is 30,000 to 55,000 a month. For the nursing, ay,
Midwifery.
okay. Oh, as in? No. Hello, Shivarun. Really? How much does clinical instructor, nursing instructor make in US? Okay, a clinical instructor in US, those who ever work in US, it is their money is like the salary. No, in their salary maybe the 36,000 pesos a month for the clinical instructor. Like what's on my research is those clinical instructor who work full time and um with a higher's degree, like master's degree, because we are not masters yet, we're still in bachelors, so our salary is much more lower than the amount of the salary I have mentioned. So this one in US, the clinical instructor, it says here, is 78,500 pesos. How much do private college instructors make in the Philippines? So we belong in the private school as a clinical instructor without master's degree. It says here, for the level college for 1 to 3 years of experience, 179,940 per month. So that means when you're clinical instructor, it depends of how long you work as a clinical instructor, and then your degrees and also your specialties. I guess that's how it is being paid by you. So yeah, that's how it is. What? Really? All right. But to tell you frankly, you guys, our salary as a nursing, as a clinical instructor here in the Philippines, like right now, because we were in a, we're here in a not so
big city. We only have the 70 plus 70. Yeah, it's just like a part-time job, but it's just very low. Will not going to mention how much it is. Hala, 422 an hour. Grabe naman yun. Really? Much more. Okay, so what's our next topic? Okay, yeah, let's continue another 5 minutes for the clinical instructor topic. What is good about being a clinical instructor is you don't work like in a in a in a lots of yeah, it's not just to me, huh? I just like the work of a clinical instructor. It doesn't because I like the teaching. Sometimes I like, sometimes I don't like. But if I would choose to be a clinical instructor and working in a healthcare facility, I would rather want to work as a clinical instructor at the moment because you are not being exposed too much to so many people who have a disease. And you if you work as a clinical instructor part-time, you can choose what time you want to go to work based of your availability schedule, and you get to know much more students, and you have new workmates. Like now, Greg, MJ Alice is my workmate, and we're just only complying 40 hours here in a public hospital, and it's just pretty much nice to also try what is it like to be working in a different hospital than the hospital I am working in a private. The settings for how they give birth and how they took care of the pregnant mother is just way much different here than the other hospital. I won't say the differences, but it's just like really different, right? The services is pretty much nice in the in the government hospital. They are being checked. They have much more doctors. Specialty of the doctors is also going around. Residential doctors is also going around. They are being they have to make sure before bringing back the patients to their home, before the discharge, they make sure that the patients is already good, like there's no any hypertension, there's no any infection. So yeah, that's what I've learned as a clinical instructor working in a different facility than here. Kinsa na yung buntis?
Yung sa isolation.
Ah, siya yun? Ah, siya pala yun. Oh, okay. Ah, siya pala yun. Ano, buntis yun siya?
Yung sa ISO ka.
Gani, oh, buntis yun. Ay, hindi ko siya mga anak. Ay, admit na siya kasi. Admit, pneumonia lang. Ayan na siya. Asan na siya? I'm sorry, guys. So, nag-out na siya. Ah, that's her.
Yung
Ah,
anak ni Rose.
okay. Okay, so I guess you gave up on the topic now, guys. It's time to have a quiz. My friend MJ Alice now is really sleepy. La la la. Okay, now MJ Alice is now sleeping. A sleeping child. Sleeping child. Remember when I told you no matter where I go, I never leave your smile, you will never be alone. And I wanna get together, even when we're gone. All right, yeah. All right, yeah. Shall we talk another topics or we don't have to talk now, you guys? No more any other talking. Ito nurses progress notes, focus, data, action response. Alright, so that's it for this video again. Thank you so much for watching Annie and thank you for the likes. Don't forget to join the VIP membership of Anne. I'd like to get to know you guys and I'd like you to... Asa order day? Siya nasa order day? Siya ang order day? Siya to order day? Okay. Right, so there's no any more viewers, so I guess we will end up the streaming right now, shall we? Okay, we're here at Dr. George P. Rayeka Hospital. Ouch. Back hurts here and there. Alright. Alright, Randy Lee, you're still there. You're still listening. How much viewers we have? Basically, I do not know. Sir Randy Lee, I do not basically know how many are in delivered today because we were not in the delivery room. We're here at the obstetrical ward. So there are, and I just knew that there's a patient transported here from the delivery room, but I do not really exactly sure of how much. Yeah, tattoo is gone. Look, it's fading. Really, no, it's fading. The tattoo, you see, it's fading. But I ordered another one, and we will putting another one here in our arms, or maybe here in this part, or in our back. So that's what we can use for the massage, right? So it looks cool, it looks great, you know. There's a new difference, another difference of any. All right, so what else can we talk about? Do you want to know how to do the proper glovings, guys? All right, so for the proper glovings, okay, have you a ball pen? So for the proper glovings, we have here a 7.5 sterile surgical gloves sterilized by gamma ray process, manufactured with natural rubber latex, and its validity and sterility of this product are assured for 5 years if the package is not damaged, open, or wet. So the sterile gloves cost about not 100, but it's just around like 86 pesos or more in the Philippines. And there's a proper way of how to do a sterile gloving, but I won't be going to demonstrate it right now because this is not our gloves. This is from owned by the government hospital, and we don't have to open this one just because we don't use it for now. So this is a 7.5 size of gloves, and my hand is only 6.5 in size. No more, no less. The 5 size of gloves is very much tight in my hands, and the 7 would also be a little bit loose, most especially the 7.5, but the 6.5 would be the perfect size of my hands, and the 6 is also much more even tighter. Okay, nothing else. All right. I thought like somebody is farting. Okay. Alright. I sleep now. It's Saturday here, guys. It's Sunday here. No, it's Sunday. How many viewers will have eight? It's Sunday. I'm so tired now here. Please do have. I'm so tired. It's a joke. I'm so tired.
Tora.
Kilala to mo?
Ambot.
Guys, I need to sleep for work. I'm so tired, guys. Alti, diba? Hi. Guys, help. Even on Saturday, I started to work on Monday until Friday. And I'm from the private hospital, and now I'm working here with my friends in a Marieka hospital for the school job completions. Um, from Saturday. So I'm working from Saturday and Monday until Friday until Sunday. I'm working for the whole week, guys. Imagine. I'm working for the whole week. Each week I'm working each day I'm working for 12 hours. Yeah, I'm working for 12 hours each day. Compute. Let's do the computation. Okay. I was working from Monday until I was working from Monday until Sunday, like today is Sunday, and every day I work for 12 hours. Shift time 7. So I'm working 84 hours this week. I'm working 84 hours. I'm working 84 hours this week. From Monday to Sunday, I'm working. Each day, I'm working for 12 hours. 12 hours times 7 would be 84. 84 hours. How many hours are there in 1 week? 12, 24. It's 168 hours. 168 hours in 1 week. Minus, I'm working for 84 hours. I only have 84 hours for myself. How many times will you sleep in every day?
How many times you sleep every day? You have to sleep 8 hours each day times 7 days. You have 56 hours. Yeah, you have to sleep 56 hours in a day, right? You sleep 56 hours in a day, and then 84, because I have remaining 84 hours from working 18 another 84 hours. I'm working for 84 hours, 84 hours left for myself, minus 56 hours. 84 hours remaining minus 56 hours. How many hours I have left? It's 28 hours. What did I do for the 28 hours? I am washing, I am cleaning, I am doing a live streaming. I am like, what else? Going to bath. I am buying a food at the supermarket. That's what I do. So, yeah, all like most of the time I am doing something online. And if not online, I am doing something at home. I am doing chores, and that's why we sleep feel sleepy even if we're at work. It's not just so easy, it's just very much hard, but it won't be much always, it won't be like this always. So I will sleep. Sige, para makita nila ba na kawawa talaga si hindi Aldous. We're very sleepy, guys. See, we're very sleepy. Because we're always working the whole time. This is the job that everyone is wanting.
Greg, dito ka. Beshi. Dai. Dai.
Ay,
Dito
laptop
ko.
kaya sa record.
Dito ako sa ilalim. Tulog. Antok pag ano. May makatulog ka talaga, galing.
Natapos ako sa discussion ko, tapos na ako mag-discuss ng IB at saka ng ng anthropometric sa kanila. At saka clinical instructor. Ang dami kong student kanina, Beshi. 66 sila lahat. Oy! Very sensitive ang mga tao masyado dito sa music. Okay, guess what this in TikTok? What is that in TikTok?
Ay, mali.
Supervisor, oh. Ay, sige, sir.
Mabuhay lagi si Greg sa may mga gwapo.
Kanina tinatawag siya lagi ng watcher na gwapo. May itsura naman yung watcher. Lagi siya tinatawag. Sabi ko, ano to? Bakit siya lagi ang tinatawag? Sabi ni sir, ay okay naman. Kasi siya daw. Sabi ko, ay okay, sige sir, good yan. Kasi ayaw ko din magpunta doon. Lagi siya tinatawag. Sabi niya, ay ito na talaga siguro ang makatuluyan ko ngayong araw. Ay na lang, Diyos ko, Lord. Dr. Greg is very busy. Like the husband of the postpartum mother called him so much because they need an assistant to check the patient. Ano pa, Beshi? Akala ko na paano, nakuwawa naman ito. Beshi namin. Oy. Ito ano, may ayun na. What happened to this? Greg. Yeah, this is just a sleepy afternoon because of no sleep.
Because they have a 20
Huh?
and 50 incision.
Because you have many incisions. Parv siya. Oh, say hi daw kay Parv siya.
I have 50.
Juan Villanueva, MJ Alice is here. You miss MJ Alice. She's very tired here, Juan Villanueva. She's very sleepy. Wawa. Oh.
We will get me some drinks and just
Some drinks. What drinks you need?
no it's so cold.
Very cold drinks, sir. How about Dr. Greg? What do you want? You want beer? Guys, Dr. Greg wants beer. I don't know. The doctors had a surgery for 5 hours straight.
I need a drink like so cold.
Cold drinks like a soda.
Yeah.
Me too.
Hindi tayo doon din sa yung milk tea.
Bali tayo.
Yung tig 29.
Ah, saan?
Just a little.
Ah, bibili tayo. Masarap yun. Doon sa labas.
I got a tip for my patient. Yes.
From Sir Greg.
Medyo kita tayo mamaya.
Saan tayo? Sige, mabidyo kita yun.
Community.
Ano yan? Marami exposed doon. Pangit ang boses namin.
Ha?
Pangit ang boses namin. Kami lang yung dapat makarinig.
Nakalong nga.
Sa SM, ay sa KCC, tik, ano lang, 150.
Nakalong.
Sige, sige.
150 for 1 hour.
Sige.
Doon 300 kasi.
Ah, meron din mahal na.
Bahal, ay, huwag na lang. Next time na lang.
Yung 150 lang, 50-50 tayo for 1 hour.
Magkasahod na tayo sa iyo.
Kaya gani, kaya gani, i-massage ka namin para
Sobrang
mag-
sikip ni, ano, may tip siya ulit.
Ah, may tip siya.
From the patient.
Okay, we have a tip from the video. Siya, Lord John.
Siya.
Dr. Greg is always farting. I smell his fart from here because the aircon is there. Then the fart fly here. landed in my nose. I smell the fart of Dr. Greg. It's the smell of the fart is it's a foul smelling.
May CCTV pala dyan.
Asan? Ay, hindi man nakita dito siya. Ay, it's a smell. Dr. Greg's fart is like foul smelling. Ang pag-ibig ko sa'yo'y totoo. Ito'y laging di biro. Pagkat sana'y paniwalaan mo ang pag-ibig kong ito.
Parsha, can you buy this one for me?
Wala si Parb ko dari.
Baka yan.
Pinalis ko na siya.
Pagkuha tayo ng ano, masarap-sarap ng ganito yung picture.
Napagod na ko. Pagod na si Parb siya. Okay, we can make another challenge. We can drink.
Parsha, where are you? Can you please buy me like that one,
Wala si Parb siya dyan.
Because I'm tired to driving. I'm tired driving. Ay, mga food panda na tayo.
Yung mahal po banda.
Hindi 15 lang.
Nag-crave ka talaga ng milk tea?
Hindi ba? Gusto ko yung mabuhay ka ba? Ang tukisi. Kaya ayoko ng pang morning beauty. Makaanto.
Gusto ko na for morning. Lalo na pag kay may demand kasi boring pag may ginagawa. Wala kasi yung ginagawa dito. Di man tayo pwede makagalaw ng mga nila, mga charts. Oh, you need milk tea too, Sir Andili. Sir Andili. We want milk tea. Sir Andili. We also want milk tea. We can't go outside, Sir Andili, so we need to order in a Food Panda. But I don't know, how can we order if we don't have more fund? I do not know what else to do here.
Dai, may duty ka sa Monday, Dai. Dai.
No, on
Hindi ka
call.
natawad yan ba? May duty ka Monday.
Sir Greg, is Wasabi
Magpunta sana kami sa iyo ba?
para?
Wala lang, makikain tayo sa kanyang boarding house.
Basta kung Monday 7 a.m., 7 p.m.
Alright, so I need to charge my phone here.
Pabayad ko sa incomes.
Bye everyone. Thank you again so much for watching. Have a blessed day. I will see you in 1 minute.
Gosh. Tignan mo, ganito lang kaliit ng 35.
Ang mahal. Food Panda is very expensive. You know how much that's it? Check. How much? It's 35 pesos only for that very small.
175.
What? That's very expensive. No way. No. It's unhealthy and it's not delicious.
245.
It's delicious but it's too much.
245.
What? 245? What in the world only for that? No. Big no. No. Not buying that. Okay, bye-bye. See you later, okay? 1 minute.